Okay, so today I'm going to be inserting and removing an NG tube. So the first thing that I would do is verify doctor's orders. And then I would identify patient. So I would verify patient's name band against the procedure card. And then I would go ahead and wash my hands. Then I will don clean gloves. Then I will assist patient in a high phallus position, if not contraindicated. I will grab a towel and place it over the patient's chest. Provide the patient with a emesis basin with some ice cubes, water, and some tissues if needed. And now I'm going to check for patency, so I'm going to occlude the patient's left nostril and have the patient breathe through the other nostril. Patient's able to breathe. Okay, so at this point, I'm going to open up my 16 French Salem pump. And now I'm going to measure the NG tube on the patient. So I'm going to measure from the tip of the patient's nostril, or tip of the patient's nose, to the tip of the earlobe, down to the xiphoid process. So once I got my correct measurement, I would go ahead and mark it with some tape. And at this point, I will go ahead and place the tip of the NG tube in some water-based lubricant, about 3 to 4 inches. And I'm going to prepare to insert. So I'm going to insert in a backward and downward position. And while I'm inserting, I'm going to instruct the patient to tuck their chin down to their chest and swallow. So now I'm inserting in a downward and backward position, paying close attention to my measurements that I marked on the tube. Once I've got the correct placement on there, I will go ahead and temporarily tape on the patient's nostril. Once it's been taped, at this point, I'm going to verify placement of the NG tube. So with my syringe, I'm going to go ahead and aspirate gastric contents. And I will place it on my pH strip. There's my pH strip there. And so it's showing that the pH is 2 and the gastric color is of a green consistency. So after I've done that, I would go ahead and send the patient over to lab to get a chest x-ray to further verify placement of the NG tube. So once placement has been verified, I can go ahead and connect the patient's NG tube to a feeding pump or a suction or clamp per doctor's orders. And once that's done, I can go ahead and remove all this equipment. I'll remove my gloves. I will wash my hands, and I will document the procedure, how the patient tolerated it, if there was any signs of distress such as gasping or coughing, and if there was, then at that point, then I would have stopped the procedure, but the patient did not experience any signs of distress or coughing or gasping or cyanosis. I document the type of feeding pump that was used, which was a Salem pump, 16 French, how the patient's NG tube was verified, which was a pH gastric aspiration on a pH strip, and also a chest x-ray. And now I'm going to be removing the NG tube. So the first thing that I would do is verify my doctor's orders. I would identify patient, so I'd have the patient state their name and date of birth. I will go ahead and wash my hands. I will don my clean gloves. will place a towel on the patient's chest. I will provide the patient with some facial tissues if needed. And at this point, I would go ahead and turn off the NG tube feeding or suction, or I would clamp it per doctor's orders. And I will remove tape around the patient's nostril. And then I would instruct the patient to hold their breath. While the patient is holding their breath, I will slowly remove the NG tube. Once NG tube has been removed, I would go ahead and dispose of properly. At this point, I'm going to go ahead and provide oral and mouth care. I'll remove the towel, dispose of that properly. I will remove my gloves. I will wash my hands, and I will document the procedure, how the patient tolerated the removal of the NG tube, and where I removed it from the left nostril, and it was a Salem pump 16 French. And the patient experienced no signs of distress, coughing, gasping, or any cyanosis.